Welcome to Module 2.12, where we explore the critical process of developing effective research questions. Well-crafted research questions provide the foundation for successful research, guiding everything from study design to data analysis and interpretation. In this module, we'll examine the characteristics of strong research questions and introduce structured frameworks that can help formulate questions for different research approaches. Understanding these elements will help you develop focused, answerable questions for your own research projects. Effective research questions share some key characteristics. First, they are focused and specific, clearly defining the scope and boundaries of inquiry. Good questions are answerable through appropriate research methods, whether quantitative, qualitative, or mixed. They demonstrate significance to the field by addressing important gaps, controversies, or priorities in current knowledge. Well-formulated questions are feasible given available resources, including time, funding, access to participants, and investigator expertise. Finally, they are ethical to address, considering potential risks to participants and broader societal implications. These characteristics help ensure that research efforts are directed toward meaningful, achievable, and responsible aims. The process of refining questions often involves multiple iterations as researchers balance specificity with broader significance. The PICO Framework provides a structured approach for developing clinical research questions, particularly for intervention studies. P represents population or problem, specifying who is being studied or what condition is being addressed. I stands for intervention, describing the treatment, exposure, or approach being investigated. C refers to comparison, identifying the alternative against which the intervention is measured. O indicates outcome, clarifying what results or effects will be measured. For example, in public health research, a PICO question might ask, among urban adolescents, P, how does a school-based mindfulness program, I, compared to standard health education, C, affect stress levels and academic performance? O. This framework helps ensure comprehensive consideration of all elements needed for a testable research question and facilitates subsequent literature searching and study design. While PICO works well for clinical questions, the SPIDER framework better addresses the needs of qualitative research. S represents sample, describing who will be studied and how they will be identified. PI refers to phenomenon of interest, specifying the focus of the research. D indicates design, outlining the qualitative methodology to be employed. E stands for evaluation, clarifying what aspects or experiences will be explored. R refers to research type, specifying qualitative, mixed methods, or other approaches. For example, a SPIDER question might ask, how do rural-dwelling older adults, S, experience access to telehealth services, PI, as explored through semi-structured interviews, D, regarding barriers, facilitators, and satisfaction, E, using interpretive phenomenological analysis, R. This framework helps qualitative researchers develop coherent questions aligned with appropriate methodological approaches and facilitates clear communication of research intent.